Will minoxidil work for a man of my age? I am almost 58 years of age, and I have a pretty good head of hair. I have had a bit of a receding hairline above temples for many years, but that's not a big concern for me at all. In the past 2 years or so, I've noticed thinning at the crown of my head. Again, I still have enough hair to cover the thinning area. I bought minoxidil, but I'm wondering if it will work for a man of my age.
Thank you for your question. You submitted a question without a photo, but you describe in this question that you are 58 years old, that you've noticed over the past 2 years that although you've had a very good head of hair, that you have receding temples, which you're not bothered by, and thinning in the crown area, which you're able to cover with hair. And you're asking if minoxidil could be of any value for someone your age. Well, I can certainly help you understand the role of minoxidil in the management of hair loss. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed based on a wound healing material that we used to help hair transplant patients. And as part of the management of hair loss strategy, we've essentially developed and almost essentially defined a new category of regenerative medicine for the treatment of hair loss. So I can offer a certain perspective as to how I discuss hair loss with my patients at different stages of their lifetime of progression. So as I've said, I developed this hair loss treatment called hair regeneration, and it was something that required a different perspective in understanding various categories of people in terms of the relative aggressiveness of hair loss. So when you describe yourself as 58 years old and still having a decent amount of hair and noticing some crown thinning, well, you are already in the more fortunate group in that you did not experience significant hair loss at a much younger age. We are treating males as early as 17, 18 years old, and as well as men in their 70s. So we eventually figured out a categorization system to help our patients be managed optimally and where our system can be used appropriately. So when it comes to the question about minoxidil, generally speaking, minoxidil, which was originally a blood pressure medication, was found to have a great side effect, which was hair growth. And over time, we've learned that minoxidil, although the mechanism is not fully understood, appears to have some stimulatory effect on hair growth and has some effect on prolonging the growth cycle. However, one thing to be aware of is, well, there's a couple of things to be aware of. One is there is a limitation on how effective it can be. And you can certainly use it as a treatment, and it is fairly safe. It's over the counter, and you apply it once a day. I think it couldn't be less problematic in terms of anything else you do. But I would also suggest that you get a view of the top of your head. A lot of times when people come to us and they have a similar question and concern, and then when we take our photos and we take a view on the top of the head, because when you look in the mirror, you basically see the front. And maybe from a side view mirror, or maybe when last time you were at the hairstylist, you noticed that thinning area getting a little bit larger. But it's important to understand that when you think of it, temporal recession and crown area, basically you only have this area of the mid-scalp. And generally speaking, people tend to underestimate the degree of hair loss. And hair loss affects both men and women throughout the scalp, and it certainly is expressed in variable ways amongst men. So it might be also a time for you to also consider a DHT blocker, such as the use of finasteride. Finasteride is currently a controversial drug, but it's not, in the experience of myself and most of my colleagues, a DHT blocker does have a role in the management of hair loss, and it is something that we do prescribe. It is important for you to get a realistic understanding of the degree of hair loss and the amount of how aggressive you want to be about management. To contrast the value of a DHT blocker to minoxidil, DHT blocker can more significantly impact the longevity of the hair follicles. And this we have seen with our hair regeneration treatment. When we've taken patients who are on finasteride for a long period of time, anywhere from a few years to over 10 to 15 years, and then we did our treatment with hair regeneration, which is, briefly, it's a combination of platelet-rich plasma derived from your own blood combined with acellular matrix. And over the past 7 to 8 years, I developed an algorithm and a system to help stimulate hair growth. The distinction here is that finasteride will allow the hair follicles to live a little bit longer. And it is my observation that it is more effective than minoxidil. That being said, when we use hair regeneration, which reactivates hair that isn't growing, thickens thinning hair, and prolongs the lifespan of a hair growth cycle, the synergy has actually worked out very favorably. Patients who were still on finasteride, they weren't growing as much hair until after we treated them with hair regeneration. So I think that in a way what your goal is to maximize coverage. I always explain to my patients that hair loss is progressive, and medical interventions, whether it's pharmaceutical, regenerative, or stem cell-based technologies, or surgical, is all about maximizing coverage. And so when you are at a point of threshold where you are seeing enough hair loss that you want to do something about it, it is my perspective that you want to do everything you can to extend the longevity of coverage and maximize that coverage. Scalp coverage is a function of hair density and the thickness of individual hairs. If you're on minoxidil and you don't use finasteride, the progression may go on faster than it otherwise would with finasteride. If you choose to do everything you can, then a treatment like hair regeneration can have a value in synergizing everything so that you can get maximal coverage for a longer duration. So, to answer the question about minoxidil, certainly it is safe and it is worth trying. Certainly a lot of the minoxidil studies have shown that to be the case, that especially with slow progression in the crown area, it tends to be fairly effective. But it's only one tool. And I think that if you look at yourself, not only the top of the scalp, but also look at your scalp with your hair wet, you might realize that you have more extensive loss than you may be aware of at this point. At which point I would say it's better to be proactive than reactive. So I hope that was helpful. I wish you the best of luck. Thank you for your question.